Hello again, everyone, and welcome to another Health Minute brought to you by Wellpoint. Wellpoint is the only healthcare plan offering healthcare benefits exclusively to Massachusetts GIC members. At Wellpoint, your whole health is their whole point. We thank our friends at Wellpoint for sponsoring these Health Minutes and for sponsoring our home here, our Wellpoint studios. Joining us in those Wellpoint studios is the medical director at Wellpoint herself, Dr. Carolyn Langer. Hello again, Dr. Langer. Great to have you back in here.
Hey, Teddy. Great to be back.
It's always fun. I feel like doing this now. We're going about 2 years of these, right? I've learned so much, and I'm ready to take my medical boards, right? Is that the test you take?
Yeah, and in fact, I think you've learned so much. I think we need to confer an honorary medical degree on you.
It sounds good to me. I'll take one of those since the journalism doctorate isn't going to happen for me. January is, by the way, Cervical Cancer Awareness Month. And for those who don't know what cervical cancer is, and count me in as one of them, what is this condition? What is this this medical issue here?
Yeah, so cervical cancer is a preventable condition. Most cases are caused by infection with high strains of the human papillomavirus, or HPV.
Is that okay? So that explains what I have. The little I have heard is about this HPV vaccine. I've seen the commercials there. How many people does this afflict? It's women, correct?
Yes. So the American Cancer Society predicts that in 2025, over 13,000 individuals will develop invasive cervical cancer, and about 4,300 will actually die from cervical cancer.
Wow. So that's, I'm just going to do some quick math in my head here. 1 in 3? Close to 1 in 3 will die from it. It's that serious of an issue?
It is. And unfortunately, certain groups such as Black, Hispanic, low income, and rural populations have increased vulnerability to developing cervical cancer.
So what are the factors that go into it? Why does it hit certain people and not others?
So there are some factors that increase your risks. For example, being immunocompromised. So people who have a weak immune system, this can lower somebody's ability to fight the HPV infection. And HPV infections are more likely to be persistent and to progress to cancer in people who are immunocompromised. So you may be immunocompromised, for example, if you have HIV infection or another disease that weakens the immune system. If you take medicine to suppress your immune system, for example, to prevent organ rejection after transplant, to treat an autoimmune disease, to treat cancer. Other risk factors include reproductive factors. So both the use of oral contraceptives, in other words, birth control pills, and giving birth to many children are associated with an increased risk of cervical cancer for reasons that we really don't understand. And then finally, obesity can be a risk factor. Cervical cancer screening can be more difficult in those with obesity, leading to lower detection of precancers and a higher risk of cancer.
That obesity, it seems like we can probably bring that one back for every condition
I think so.
that we talk about. What are some of the strategies that can be used to prevent that? I know some of those things, it sounds like you can't, right? If you've gotten an organ transplant, you have to be on certain types of treatment for that. That you can't do anything about that. Are there other risk factors that you talked about, though, that can be mitigated or even prevented?
Yeah, so cervical cancer is often preventable, and it's more easily treated when detected at an early stage when treatment is more effective. So, for example, preventive vaccines, we talked about the HPV vaccine. This can protect against the virus that causes most cases of cervical cancer. In addition, preventive screening. So regular pap smear tests can catch the disease early, allowing for effective treatment.
So the HPV vaccine, that's the one you see a lot of ads for, especially on television now. Is it for everyone? Is it something that people should do as a preventative measure? Is it something you get if you're only on the risk factors? Who should be getting that?
No, so everybody should be given the vaccine between 11 and 12 years of age, although it can be administered as young as 9 years of age. The vaccine is most effective when it's given before you become sexually active, but is recommended through age 26.
Okay, that's a pretty wide range of ages there, right? And you're starting very young. So anybody with a young daughter in that age range, you recommend getting her to a doctor and start these screenings, but also consider the vaccine?
So generally it's recommended between the ages of 11 and 12, but again, it could go down as young as 9 years of age.
How much does it decrease the risk?
So being vaccinated would decrease about, it counts for about 90% of all cases of cervical cancer that could be reduced by getting vaccinated.
That's significant, especially when you go back to the numbers you stated earlier of how many people end up dying for it and how many people it hits. So some good stuff there. Of course, I would imagine that these types of screenings are a regular part, and access to the vaccines are a regular part of the treatments at Wellpoint and anybody covered under this plan.
Oh, yeah, absolutely. So this is just part of good preventive care.
All right. Well, we appreciate it. Now I feel like I know a little bit more. Next time I see the commercial, I'm going to have a little bit more knowledge behind it. Dr. Langer, as always, thank you for joining us. We'll catch you next month.
Thank you. Great to be here.
Always good to have Dr. Langer with us. Always good to have you as well. We hope you learned something. I know I did, but that's why we bring you these health minutes, and that's why our friends at Wellpoint help bring you these health minutes. Until next time, thank you for joining us. Everybody stay safe out there.